back, everyone. It is us. We are Be Defray
in the house.
And today we have an amazingly special guest. We have Dr. Traci Kimball, who's a resident wound doctor here, she's a doctor, but she's a wound expert specifically here in Denver, Colorado.
That's a lot.
That is a lot.
Thank you. Yeah.
So how would you like to call us? Dr. Traci? Traci, how would you like to be referred to?
Well, one thing you couldn't say that would be kind of cool for branding would be Dr. Traci, otherwise known by her patients as the Wound Wizard.
The Wound Wizard. Okay,
magic,
I like that.
It's a magic because it is official. We are on the trademark registry.
Oh,
so
okay,
that's cool.
What exactly?
They can search that on Google or Instagram, and it's my page.
Got it. I was just going to say, educate me because I'm not entirely up to speed.
No, you're not. Well,
help us, Dr. Traci.
Well,
help us.
No, I actually, just so I could just distinguish myself as a expert in wounds. One of my patients gave it to me many years ago, and I just went ahead and branded it. Okay. Submitted it to the patent office as a trademark.
Huh.
Did you know that you could trademark yourself?
I can't use that because that's not...
You can't do that?
That is crazy.
It's trademark.
But you can. So, quick question for you though, Dr. Traci. So, that's so really cool that you're very specialized in the wounds and all that. So, what got you into this before we start asking some further questions? So, what appealed you to, hey, let me focus on this because this is something that is helpful or whatever. So, help us understand that a little bit.
Well, I'm just a general surgeon by training. So, just a general surgeon. But by training, I did general surgery. And as surgeons, we create wounds. And wounds our patients are typically all ages. I typically deal with an older population now, but in training they were of all ages, even from children to sage age adults. And so I was introduced to wounds through surgical training.
Gotcha.
And then realized that wounds can be developed, or just in general we call it skin injury, can develop from trauma on the skin, from burns on the skin, from chemicals on the skin, from infections on the skin, from surgeons that bring a knife to the skin.
Yeah.
And depending on the patient's ability to heal or the skin to repair, a wound may become chronic and become almost symbiotic, living with the patient. And so specialists are introduced to the care plan of the patient to actually help that patient get to a full, whole, closed position and heal their skin. Because anytime the skin is broken, there's a risk of infection and a risk to potentially life.
Yeah.
So real quick, just to spit this out there, give us a real quick synopsis as to how, as a wound expert, you would take care of mending those scars.
So the first step is to understand the reason why they have a wound. Many times it's surgery. I bumped my leg on the side of the wheelchair in my patient population. I fell and scraped my knee, or I went rock climbing and I scraped my elbow, or I burned myself because I dropped hot water, or decided to smoke with my oxygen on and singed my nose hairs, or worse. Yeah. So the first step is to understand the reason. And once we understand the reason, we also need to understand the patient's medical problems. So we get a good thorough history of their medical problems, because many medical problems like diabetes or malnutrition, even obesity, can all delay the wound healing process. So once we get those answered, then we proceed to determine what are the other barriers of healing. And some of the big ones are infection. Sometimes it's pain. They just cannot tolerate the cleaning of the wound. So we have to treat that sometimes. And once we understand the full assessment of the wound and the state it's in and how old it is, and then we can start to one by one attack those different barriers and attempt to reverse them and encourage the body to activate its own healing mechanisms to then heal.
Okay.
Wow.
So not like your typical, I got a scratch and put some Neosporin on it for us.
Yeah.
People who are,
Well, I mean,
Not aware.
yeah.
the complexity of chronic wound healing is significant. And so a scratch on your skin or a paper cut, where you put some Neosporin on it, those are typically really straightforward, and they're called acute wounds. And so we do these first responder measures,
Right.
and most of them will get better. But in a cadre of patients that have, like I said, all those different issues in health, then even a small little paper cut can turn into a massive infection.
Yeah.
On, say, if it was in a diabetic patient. So even small breaks in the skin in diabetics can lead to infection and then additional skin injury from the infection, which leads them with a larger gaping,
My goodness.
penetrating ulcer is what we call that.
Okay.
This is like all brand new to me. I didn't think it was so specific to the person. Of course, I mean, I feel like just give Tylenol and everything's going to be good.
Yeah.
But it's very different because
It
depending
is.
on the diet and your genetics and all the craziness that we all have. within
And even
us.
now, learning like age, it wasn't something I thought about before. That based on your age, how quickly or slowly you will heal. That's interesting.
Right. And actually the healing